Hi guys, Dr. Uyiosa here. In today's video, I'm going to be reacting to Angela White's, formerly known as Blac Chyna's, recent interview where she discusses her plastic surgery removal journey and her silicone injections. And we will be doing a deep dive into the topic of BBLs and silicone shots. Hello everyone, my name is Dr. Uyiosa and this channel is on all things health, business and finance. My goal is for us to get healthier together whilst making better money and business decisions.
Okay. Silicone injection shots is loose silicone. It's not in a bag, it's not in anything. So now you're just injecting a foreign object into your body.
With silicone injections, when the ejected substance is inserted into the body then sees it as a foreign object and mounts an immune response to it. Now, if the immune response that the body has is overwhelming, it can lead to something called sepsis, and that can actually be life-threatening. And if the body does not overreact, it will try to contain the silicone with scar tissue. And this ongoing attempt to contain it leads to more and more scar tissue being formed, and this can have a negative impact on the surrounding tissues found in the area and can actually damage structures such as the nerve and can also cause changes to the skin found in the area.
It can travel to different parts of your body. It can travel.
Blac Chyna is absolutely right. A fat embolism is basically when a piece of fat is dislodged and gets into the bloodstream and can therefore block the blood supply going to different parts of the body. And I've actually seen a fat embolism happen mid-operation. It was really bad. They ended up having a cardiac arrest and having to end up in ICU.
We've had stories of, I can't even repeat some of the heinous reports about what people have injected. Some have even gone to jail as a result of causing deaths.
Due to the complications associated with silicone injections, they are only licensed for use in certain eye operations in the US. And according to the British Association of Aesthetic Plastic Surgeons, use of silicone injections is not encouraged in the UK. I think it's great that celebrities are being open and honest about their plastic surgery journeys, just because it showcases both sides of the spectrum, particularly the negative sides of having plastic surgery. And I think in having these conversations, people who aren't doing the research but are jumping onto the latest plastic surgery trends will be a bit more informed on the potential negatives associated with these trends. If you do want plastic surgery, please make sure that you do your research. Speak to a health specialist, make sure that they're board certified. If you are going to go abroad, then make sure that the place that you are having your operation done has high medical standards and meets the criteria, just because different countries have a different standard at which they follow when it comes to surgery and their medical practice. The BBL is a Brazilian butt lift, and it basically involves taking fat from a donor site, and this could be the lower tummy, the lower back, the thighs, the arms, and this fat is then injected into the desired area, which in this instance would be the bum region. Now, the operation can be broken down into 3 parts. The first part is liposuction, which involves actually removing the fat cells from the donor site. And then the second part of the operation involves processing those fat cells. So the fat cells are taken, they're placed into a special machine where they are spun. And the purpose of this is to purify the fat cells to improve the outcomes of the operation. And then the last part of the operation is injecting those purified fat cells to the desired area. And the reason why an individual would do a Brazilian butt lift is basically to improve the contour or the size of their behind. What's really interesting is that this type of operation, known as fat grafting, actually can be traced back to 1863, and one of the first clinicians to perform this type of operation was known as Nuber, and he did it to correct the deformities associated with operations in cancer patients. So I'm going to go through the common complications associated with BBL. So the first one is fat necrosis. Cells in the body need a blood supply, And if the fat cells aren't able to form their own blood supply or get blood supply from the structures around them, they will die. And if a considerable amount of fat cells die, then a process called fat necrosis occurs, and that can result in the actual area looking different or having a slightly different contour to a part of the body that hasn't undergone fat necrosis, which can lead to dissatisfaction with the operation. And other complications can include reacting to the general anesthetic that's used, infection, bleeding. I hope you enjoyed this reaction video and learned something new about surgery. If you did, don't forget to like, comment and subscribe, and most importantly, share this with someone who needs to know about the complications associated with plastic surgery, and I'll see you in my next video. Also, if you'd like me to do any more reaction videos, then definitely drop a comment on what videos you'd like me to react to, and I will take them on board when planning my next set of YouTube videos.